Okay, so in this video, we're talking about really how there's only 3 ways to handle a problem. I would consider back pain to be a serious problem. Some people, it's more serious than others. For me personally, it was very serious back in 2004. And we're going to highlight the 3 options that we have to handle a problem. We're going to highlight how back pain falls under only 2 types of injuries, and also how we know that back pain typically gone ignored only gets worse over time, not better. So let's talk about the 3 ways we can handle a problem. So we know that the first option, which again is usually what I've been told by my wife that I do the most of, is ignoring the problem. And so when we have back pain, it's not, or sciatica, it's not that we're not talking to our spouse about it, or to our friends and family, or to our coworkers, or even to our doctor. But when we are talking about it, that doesn't mean we're doing anything about it. In fact, we're doing nothing about it. We're just complaining about it. We're thinking about it. Maybe we're Google searching. We mentioned it to our doctor. Maybe our doctor laid out several options for us, but we haven't taken any options. We haven't done anything yet. And so it's really hard to find a problem that gets better over time when you ignore the problem, right? I can think of a classic story that I tell, and I have many stories of me ignoring problems, but one of them that rings true is when I first started our physical therapy clinic back in 2010 or 11. We were in a small facility in this historic building in town here called the Grand Traverse Commons, and it had the tile kept getting stained above where we would treat a treatment area with patients. And so I had told the landlord, and he was a great landlord, and he was trying to address the problem by calling the HVAC company, and they would come and they inspected the air conditioning unit and the heating unit and said it was the roof. The roofers came. The roofers blamed it on the HVAC, and they kind of went round and round for a few months, and nobody really did anything. So we were all talking about it. I knew about it, but there was nothing being done to handle the problem until finally one day the pipe burst and the clinic flooded and we had to shut down the facility. So it's a classic example of how it turns out it was actually the shower. There was residential condos above our clinic, and the shower pipe actually burst from the drain, which is super gross. But anyways, ignoring the problem is not a good option. So what do we do when we have back pain? When we ignore the problem? So number one thing we do is we have certain activities that usually cause more pain. So golfing would be a classic one. Sometimes walking, yard work. Maybe it's certain things around the house or in our jobs. We'll just stop doing those things. And then it doesn't hurt as bad, right? So that's an example of ignoring the problem and hoping it's just going to go away. So again, ignoring it's not a good option. We want to move beyond that. We need to, in fact, move beyond that. And if we don't, I'm going to show you in a minute here how I know that back pain gets worse if we ignore it. And we'll prove that in a minute. Number 2 way to handle back pain or any problem is to alter the situation, right? So unfortunately, going back to that example with the tile leaking, we were changing the tiles out. And I would do that, I think, once a week, which is kind of silly. But I couldn't stand the way it looked, and it was right above a treatment area, so that was not good. It was embarrassing. So that was altering the tile, right? We were just changing the tile. We weren't fixing anything. We were only altering the situation. A classic example, or many examples with back pain, is when you are altering it. You may have gone in to see a doctor, and the first thing typically you'll get is either a pain medicine or an anti-inflammatory. So we know that all pain medicines, whether they're narcotic or not, only alter the perception that your brain feels the pain. And so you're just altering the thing that's causing the pain isn't changing, but it's your perception of how it feels changes. So that's like the classic example of altering it. Now, it's important to recognize that, that strategy becomes ineffective with pain medicine as time goes on because the brain gets used to the pain medicine. So you need more and more. Not a good mixture, not a good recipe. In fact, that's why most people accidentally overdose, is because they start taking more of the pain medicine because it's becoming less effective, and then your breathing gets depressed, and then you fall asleep and don't wake up. I've been there myself. I almost did that on accident. And so another example is altering the situation is anti-inflammatories. So we'll talk about in a minute what inflammation is, but an anti-inflammatory just alters the body's inflammation response. But in a minute, well, I'll show you how inflammation is actually necessary in order to have the healing take place. Other examples of altering it would be like medicine to change the way that our nerves conduct the signal. That just like Neurontin is an example. Wearing back braces alters the posture or the stability around the spine. Maybe changing the way that we do activities instead of just not doing the activity like I said earlier with ignoring it. Maybe we're altering the way we're doing the activity. An example might be a golfer who just takes a shorter backswing, or somebody who's walking when they have back pain, they just have shorter steps, or they walk less. You're just altering the situation. But unfortunately, this is what most medical care for back pain falls under the category of altering the problem. I would even argue that surgery, in many cases, alters the problem. For example, I had a back surgery that didn't provide relief for me back in 2004. Where they went in and removed a herniated disc or a bulged disc. But if you back up and you say, okay, the thing that actually caused the disc to bulge didn't get fixed. They just removed the disc that was bulged, right? That's why the disc bulge came back 2 weeks later, because the underlying problem was actually in my hip. My hip wasn't rotating, therefore my spine had to rotate more than it was designed to, which caused the disc to herniate again. So the surgery only altered the structural damage. It didn't actually fix the thing that was causing the damage. So again, altering it becomes the traction, mechanical traction, or hanging upside down. There's an example of altering you're just decompressing the spine, right? So you temporarily open up the hole where the nerve comes out. And again, you go back to living and it goes right back to where it's supposed to be, or where it was before. So you didn't change anything. Other things, machines, modalities, creams, Icy Hot, Bengay, BioFreeze, laser treatment, ultrasound, hot packs, cold packs. All those are designed to either alter the way that you feel pain or alter inflammation. And really the third way that we want to handle this problem, that we can handle all problems, is to change the problem. So in order to change this, we know that most back pain is a biomechanical problem, meaning something's not moving right in the areas around the lower back. And so we need to address those areas in order to find a real solution. So again, this graph is a really great representation of how if you ignore back pain or just alter it, it's going to get worse over time. And here's how I know that. So if you want to simplify it, back pain is an injury to tissues, but there's only two ways to injure tissues in the whole musculoskeletal system. Number one is what's called an acute trauma. So let me first reference you to the X and Y axis so you know what's going on here. So the X axis represents time. So as you move to the right, time increases. And money. So money increases as you move to the right, and so does time. As you go up the Y axis, dysfunction increases as you move up. So dysfunction might be pain, stiffness, weakness, numbness, tingling, whatever it is that you're struggling with. As you go up, the dysfunction is higher. Now, this red line on day one has really high dysfunction, and that's represented by what's called an acute trauma. So think car accident, or I fell off a ladder, or somebody hit me in the spine. The day that it happened, I know exactly when it happened. That moment I can remember. It was slow motion. And I had to go think dysfunction high. I probably need to go to the emergency room. And as time went on, the dysfunction got better on its own, usually with fairly little intervention. But the body healed itself over time because the acute trauma that caused the damage in the first place is gone immediately after the thing happened. So think car accident. Now, the other type of injury, which is what most back pain is, because when you meet people with back pain, they don't usually have a moment in time, an incident. There was no trauma as far as like a car accident or a fall, usually. That's called a cumulative trauma or gradual onset injury. Day one, there was no dysfunction, but as time goes on, that dysfunction was gradually increasing. I didn't even feel it until this area, which is called the detection zone. And even when I started to feel it, it was only like once a month or once a year. But now as we move up to the right, it's become more frequent and more dysfunction. So I have pain all the time and I can no longer walk. as an example. And unfortunately, I see people usually way out here. It's expensive, the dysfunction's really high, and it's been going on for a long time. That's what happens. These could also be called biomechanical problems, meaning the body's not moving properly, and if you don't address it, it continues to get worse. It's like the alignment on your car. If you have bad alignment, the tires are going to wear out as time goes on. And you can keep replacing the tires, but you're going to end up back over here where the tires are worn down. You cannot treat a biomechanical problem by altering the biochemistry. So if I have a movement-based mechanical problem, I can't just fix it by taking a pill, is what that means. Now, remember earlier how I talked about altering it. Number 2 option for handling back pain is the most common treatment we get. Well, the most common treatment we get is anti-inflammatories. That might be medication or injections. And if you look at this is a diagram to show you the 4 phases to the healing process. So there's 4 phases the body has to go through in logical progression. One has to come before the other to get to the next one. And you can see here that phase number 2 is actually called inflammation. It normally lasts between 3 and 20 days. And inflammation's role is to come into the area, and the cells get damaged from physical stress or trauma. And the inflammation comes into the area, and its goal is to remove the damaged or dead cells and remove those and get them out of the way so that the body can lay down new framework for new cells. So there is plenty of research to show that anti-inflammatories actually delay the healing process. And so that's why, again, it's not going to give you a solution by continuing to take medications and injections for relieving your back pain, hoping that's going to give you a solution. So ignoring it is the first option, but it's not the best one. Based on the timeline for healing, 6 weeks, and let's go back to this. So you can see here that phase 3 takes between 1 to 6 weeks, and the final phase takes a minimum of 6 weeks. So when somebody calls me and they first have back pain and they are asking me how long should they wait before they get help, I would tell them don't wait any longer than 6 weeks. But if you don't notice improvement within the next 3 to 4 weeks, you should probably get some help. And that's based on some science that you don't want to ignore it. The longer you wait, the harder it is to get rid of, as well as the more expensive it is and the more dysfunction develops. So again, we know that if it takes longer than 6 weeks to heal, it's probably a cumulative trauma type of injury. Most back pain is cumulative trauma type. So again, that gets worse over time. So rest equals ignoring it, and rest is bad. It's important to recognize that no matter what type of back pain you have, it might be, and we'll cover those types in this course, but it might be a disc bulge or herniation or arthritis or mechanical or SI pain. All of the back pain has inflammation. There's all inflammation associated with all back pain because there's tissue damage and the body's trying to heal itself. So inflammation is normal when there's damage. It happens all the time. It's how our body heals. So we need to stop focusing on just inflammation. That might be aspirin, ibuprofen, spinal injections of cortisone. Most machines that you get, like TENS units and ultrasound and electrical stim and lasers, I have all those things in my clinic, but I'm telling you, they all just alter inflammation. Why do we do that? Well, we do it to relieve pain fast. So I'm not opposed to somebody doing that, but if that's the only thing that you're doing, you're only altering the situation. You need to be doing that while you're fixing the mechanical problem. So again, it only alters the problem, and it actually can slow the healing process down. So I don't want people to be out there suffering by not taking pain medicine or anti-inflammatories, but I want to encourage you, number one, to do something about your back pain. Recognize that it's a movement or mechanical problem, and you need to, in addition to controlling your pain, you need to find out what the problem is and address the problem through improving the motion. Not to mention there's risks with all medication and injections, so you have to recognize that the risk reward, you have to be careful. Again, other common treatments that only alter the problem: pain medicine, nerve medications, creams, ointments, braces. The new thing lately with the creams and the ointments is the CBD oils, traction devices, massage, chiropractic, and even traditional physical therapy. Those only alter the symptom of pain. And again, with chiropractic, we do that too. We do what's called spinal manipulation. We also do massage. But again, if you're only focusing with your massage or your chiropractic or your physical therapy on the lower back itself, you're still only treating the symptom of pain, because the areas above and below are what are actually causing stress. And we're going to get to that later in this course. So again, all of that is simply altering the problem. And in my perspective, surgery is the biggest altering of them all. It's why the majority of people are in pain 2 years later. And when I say majority of people, studies now show that 50% of people that have a back surgery continue to have pain 2 years later. That just proves that it's not the solution. Too high of a risk for such a low reward. So none of these options address the biomechanical problem. So how do you change the problem? Well, you've got to change where you're looking for the problem, right? So if I were to go back to that example in the building that we were at when we opened our business and the tile was leaking, if my mind only focused on the tiles being replaced, I would continue doing that the rest of my life because the tiles weren't the problem. Just like your lower back, I will talk to you and educate you on how it's not the problem. You need to look elsewhere for the thing that's causing the stress in your lower back. It's not the back's fault. Think of the back as an intersection of movement. So every movement that you do, every time you move your hands and your head and your nose and your eyes, and every time you wiggle your toes and move your feet, your ankles, your knees, and your hips, your back is moving. And we have an intersection of movement that occurs in the lower back. So it has to transmit the energy. If those areas aren't moving properly above and below, it's going to force the back to do too much, which causes tissue overload, stress, and damage. Every movement in the body from above and below travel through the back. The damage in the back comes from excessive stress. And in this case, the stress is movement-based, physical stress, which again, the damage triggers inflammation and pain. So again, the key is to reduce the stress by improving the motions above and below the back. I will talk to you more about that as we move forward in order to reduce the movement in the back itself.